Chef and musician Dylan Harris is recovering after a long journey to receive the right medical care for a potentially life-threatening condition.
I would get these very short periods where if I would sneeze or cough, I would black out.
The pain led Harris to the emergency room, but with a backlog of patients and long wait times.
As weird as this is to say, being at a hospital, I was too sick to stay there, and I just couldn't wait.
Harris instead logged on to a virtual clinic.
And it ended up being totally life-saving care. It was a benign tumor encased with a sac of liquid. It was about the size of an egg.
Without access to family doctors, many patients turn to ERs, putting further strain on an already overburdened healthcare system.
The founder of Rocket Doctor, a site that virtually connects patients in need with available doctors, sees care provided online as a lifeline for Canadians, including those in rural and northern communities.
What we've done is built a system that enables licensed Canadian physicians to see patients who are in the province where they're licensed to practice medicine, completely free of charge, using your provincial health insurance to do so.
The Canadian Medical Association, the College of Family Physicians, and the Royal College of Physicians and Surgeons of Canada together formed a virtual care task force. And in these two recent reports identified barriers to virtual care, like ensuring appropriate online care services are provided as part of the publicly funded health system, and calling for a framework for pan-Canadian governance so health professionals can practice more broadly across provincial borders.
We have to deal with a very complex patchwork of what you're allowed to do in different provinces, who's allowed to treat who. So there's a lot of rules which I think made a lot of sense in a different era, which maybe don't make a lot of sense right now.
Tell me a little bit more about your headache. When did it specifically start?
With the click of a button, Canadians can now also visit virtual emergency departments.
60% of our patients need no further care outside of the virtual ER, which is a pretty significant proportion of the patients we see. 40%, some of them need to see their family physician follow up, and some are sent to the ER.
Marking a shift in how healthcare is delivered and potentially easing some of the strain on the system. Caryn Lieberman, Global News, Toronto.